Got my cute apron on. Not cute, it's beautiful actually. Handmade, I got it on Etsy. So beautiful. But yeah, that, and I'm too lazy, so the plantain in the air fryer. It's okay. And then I know it's Panera, don't judge me, but I picked up this nice bread. So that's gonna be dinner. Fish, plantain, and bread. Didn't get to last night, but if I can imagine all of this, I must be broken. If I can imagine all of this, if I had a hard time, know that I was on time to feel the stuff turned out. Let myself down and wait for help now. My yoga series. I'm Jay. I am a birth worker, a postpartum recovery practitioner, and just do a ton of things in birth and stuff. So I am also a certified yoga instructor and sort of incorporating a lot of different methods, modalities, things that I've learned and been certified in to I must be broken. Hello everyone. It's Jay and my 1,000 lives. Welcome back to my YouTube channel. If this is your first time here, thank you so much. Tell me if you got anything informative out of this in the comments. And if you're coming back, thank you so much. I appreciate you. I care about you. And I'm glad that you are so willing to join me on these sessions. I've been out of the loop for a while for a number of reasons. But which I'll showcase in some vlogs later this summer of my family's summer adventures, which were like, it was just so recharging and so refreshing, and I'll just leave it at that. But anyway, thank you for coming back to this series on where I kind of just talking about the business side of being a small business owner. If you don't know, I own 2 businesses. I own a PR and strategic communications firm called Pen and Thread. And so if you feel like you need help for communications for your business, hit me up. And I really want to support small owned business, solo entrepreneurs, just sort of help you find your brand voice, be able to tell your story, because every single brand has a story. From an HVAC company to a donut shop. You don't have to be this big fortune, whatever, startup to need a communications specialist in your corner. So the sooner you get one, the better. So hit me up for that. Or I also am the proud founder and owner of Flower and Fox Doula. And I am a full spectrum doula. So from fertility through birth and postpartum. And yeah, so today's episode, this part of this series, the episode that, oh my gosh, I can't speak. Still on vacation mode. But today what we're talking about is like myth versus truth as it comes to what a doula does and what a doula can provide for a family in terms of the whole pregnancy, maternity, fertility, postpartum journey. As I've mentioned before, there are different types of doulas, but truly the word doula like comes from the Greek word of like with woman, and it was, or serves a woman, so it was someone who like served women, particularly those who were in labor. Please don't mind my ratchet ass nails in this whole video. So there's a ton of myths out there and misconceptions about what a doula is and what a doula doesn't do. I also feel like there's a lot of doulas out there who blend a lot of roles together. I also feel like there are enough doulas out there who are operating outside of their scope. So I just kind of want to help clarify what a doula is. Now, you might be an OB/GYN or a labor and delivery nurse who is also doula certified. Maybe the doula certification help you expand your knowledge in those professions. But what's important is that you distinguish what role you're in at a certain time. And I'll kind of dig into that a little bit more. I'll just talk about it now as a quick example. So if let's say you're a psychologist or a therapist, and you're also a doula, and you are a therapist treating someone and they happen to be pregnant, you can't be their doula because you're their therapist. But you can recommend them to someone else. But having the training and certification as a doula can probably help you better treat that person. Or if you are a doula and you have a client and then you start to realize, okay, I think they need some therapy, you can refer them out to therapists. But if that session is doula specific, like, you can't start treating them as a therapist because it's out of your scope of work in that time. So you can, as a doula, recommend resources and refer them to other providers. But like, you can't become a therapist. You can't go into therapist mode during a doula, like, prenatal or postpartum visit. Hope that makes sense. Okay, so let's dive right in. So some misconceptions versus reality. I think a lot of people have this, or there's this myth out there that, like, a doula delivers babies. That is not true. And by deliver, I mean like hands-on catching a baby. Now, there may be some doulas out there who had to do it because their client labored really fast at home and like they were being supported over the phone with 911 or the EMT or whatever, like, until the EMS or EMT arrived or medical professionals arrived. But we doulas do not intentionally catch babies, and we don't perform any medical procedures. You might hear us say a lot the verbiage of providing continuous emotional, physical, and informational support at any time before, during, and after birth. So if you are in labor and your doctor comes in and is like, I'm recommending a C-section, your doula is probably going to be like, hey, do you have any questions about the C-section, like what the benefits, risks, alternatives might be, and do we have time to make this decision? Does the family have time to make the decision? And I want to talk about this more too, because the doula is not a decision maker. So that's like one myth. Another myth is that a doula can replace or be there instead of an OB or midwife. Like I said previously, a doula is not a medical professional. So no, a doula cannot replace your OB or your midwife, but they can complement them, right, and be a part of your birthing team. Your healthcare provider is the one that's managing your and your baby's medical care, and the doula is focusing on your comfort, education, and advocacy during that treatment. So I like to say the healthcare providers are there to keep you healthy, keep you alive, and I'm there to make sure that they're treating you as a human being while they're doing that and respecting your patient's rights. The third thing, or another one, is that some people believe that doulas are only for home birth. This is not the case, and I would argue that people who are having births in hospitals are in more need of a doula than people having babies at home or birthing centers where there are midwives. I, as a doula, most of the births I support are actually in hospital. I've only done one birth at a birth center, and I've done 3 home births. I've also supported some unplanned C-sections and scheduled C-sections as well. So another misconception is if I get an epidural, if your client gets an epidural, they don't need a doula. That's not true. Pain relief is just one aspect of birth. Doulas were there to provide reassurance, positioning. So even though you have an epidural, you still have to move. The epidural is fentanyl, and fentanyl is not in your spine, it's in your spinal fluid. And so fluid, gravity, if you don't move during an epidural, like switch sides every 30 to 45 minutes, all of the fentanyl medication will move to one side of your body because of working with gravity. And so a doula can help you get into some optimal positions, even though you're getting an epidural. We're also there to support your partner, help with facilitate any kind of communications, and as emotional care as well throughout labor. And some people get an epidural and that shit don't work. I haven't seen that often. Trying to think. I haven't really ever seen that. No, I haven't. But that mom had precipitous labor. But that's something to keep in mind. You're like, oh, I'm getting my epi, I don't need a doula. I don't think that that's the case. All right, the next one is that a doula is gonna speak for you or fight with the medical staff. There are some doulas who do that, but that's not me. And I don't believe that that's a doula's job. A doula, again, does not make medical decisions or argue with providers or be combative. They can help you better understand, or as doulas, we should be helping people, our clients, better understand their options so that they continue to communicate their own preferences confidentially. A doula, I'm not there to convince you to not get the epidural. I'm not there to convince you to not get a C-section. And I'm not gonna yell at your medical staff. I might be a little petty or passive aggressive, maybe. A good example is like, if a nurse is like, oh, well, I have to check you to see where your baby is. I'll be like, do you? You can't tell from the heart rate on the monitor? Like that. Like, I'll be like that. Okay, another thing is that people think if they get a doula that their partner or support person or husband is going to be replaced. That is not true. Unless you have an overbearing doula. I'm like, that's not my jam. I'm here to support the birthing person, the mother, and their husband or wife or partner. I want the partners to feel like they're more confident and involved rather than taking over their role. I prefer to be a fly on the wall and just kind of step in if I feel like maybe dad needs a water break himself, or maybe his hip squeezes are not as efficient as he believes they are. Things like that. Another myth is that people believe that doulas only help during labor. This is absolutely false. A doula can help you, like I said, from fertility to birth to loss, bereavement, abortion, and there are death doulas, but that's different. That's more for like older folks, or not older folks really, but like it's more prevalent with older folks who are like in hospice. Or even like, adults, like younger people who are also in hospice or preparing for end of life. But a bereavement doula is what helps, like if you have a miscarriage. But we provide prenatal education, postpartum support, which is like my fave, as well as newborn care guidance, feeding support, so breastfeeding, emotional wellness, literally sitting there and talking to you for 4 hours and listening to you and not judging you and not giving you advice, just there to listen and hold space. Helping with recovery, that's like one of my main focuses as well. And family adjustment. There are also sibling doulas who can help the older children or the older child get used to having a new baby in the house. Another myth is that if you hire a doula, it means you want an unmedicated birth. So as a doula, I'm here to support your goals and not a specific birth plan. So whether you're choosing an epidural, a planned C-section, an induction, or an unmedicated birth, I'm here to support you with informed choices. So I'm not going to try and convince you otherwise. I'm going to give you more information on the ways that your goals can be met. You may change how you want to do things, like during our partnership, and that's great, but I will never convince you to do anything, and I will never judge you based on your own personal birth plan goals. Another thing is that a myth is that people believe that doulas judge parents for their birth decisions and preferences. Okay, a professional doula will not do that. We are non-judgmental, like Planet Fitness, a judge-free zone. I use evidence-informed care to support families regardless of how they choose to birth or feed their baby. So, like, why I'm really excited when a mother chooses to breastfeed and makes it over the huge hurdle that I think is like around the 8-week to 12-week mark, to be very honest with you. I'm also very supportive of a mother who from day one is like, I'm giving my baby formula. That's your choice. And I'm not judgmental about that at all. Another myth is that doulas only help first-time parents. Not true. Every birth is totally different. And experienced parents will probably hire a doula because they know the value that comes with continuous support, or they just want a different experience than a previous birth. The other thing is a family can have a doula the first time and then hire a different doula the second child. That's like totally chill too. Like, that's totally fine. Maybe they want different type of doulaing and support in the second round. Some people believe that postpartums are baby nurses or newborn nurses. This is not true. We're not. A nurse is a medical professional. We're not. So even though we can help with newborn care, the postpartum doula primarily focuses on the recovering parent, the mom that just gave birth, and then the family as a whole, to help everyone adjust to this new, this big change during the 4th trimester. But a postpartum doula is not a baby nurse. That's just, no. The final thing I want to cover is that having a doula is a luxury. It's not. It's an investment, okay? Because what you're getting out of it, if you get a really great doula and you save money to pay that doula their worth and their value, is like you're investing in education, or the clients are investing in education. The families are investing in confidence, having more confidence before they go to the birthing process or go through birth and postpartum. And then you're also investing in support. Like I said, if you had a baby the first time and you didn't have a doula and you were 4th trimester, what the F? And you get pregnant a second time, you know you want a doula, whether it be birth, postpartum, or all. That's an investment in having support and having a village. I heard someone say oh, the village should be free. No, not in this day and age. So having a doula is great, especially if you don't have a big village or you don't have any family around. And also a doula can help you build a village if you have peoples, right? If your people are here, we can help you identify people that you trust, key players in your life that can come in, take out the trash, make you a meal, hold your baby while you shower, or just sit down on the couch with you for 4 hours and binge watch Love Island together. Go on walks with you, go on hikes with you and the baby, blah, blah, And we all, well, I don't say we all, but most doulas understand the value that a doula brings because it is research-based. Like continuous labor support has been shown, like continuous labor support of a doula during labor has been shown to have improved birthing experiences. And some studies suggest lower rates of different types of interventions like a C-section or an epidural. So a doula is not a luxury. I know some people think that it's like this bougie fancy thing that only rich people get, but that's not the case. And a lot of insurances, if not all, to include Medicaid in most states in the US, are now starting to cover doula support if they haven't already been doing so. Now, if you use your insurance, you're probably not going to get the whole kit and caboodle like you would if you self-paid. But what you can do, if you're a potential client seeking out a doula, you can use your insurance to cover like the basics. Like, what are their basics? And it's typically like 3 hours worth of prenatal support during the continuous labor. And each doula is different. I support once active labor starts. Now, if it's early labor and you're freaking out, I will come and check on you. But I'm gonna let you know, like, I'm not coming back until you're in active labor, because that's just, a doula is an intervention. Every time I come into your home, I change the environment, and that can actually stall and disrupt your labor. So if you're coping really well while I'm talking to you on the phone, I typically say, I'm gonna call you back in 2 hours to check on you, so that your body and your mind knows, and you're anticipating that I'm gonna reach out in a bit. I forgot what else I was gonna say. But yeah, those are just some myths to think about, like, or misconceptions. The ones that I can't stress enough is that we're not medical providers. So if you ask me, should my kid get a vaccine, I'm going to tell you to consult your pediatrician and your provider. And I'm going to leave it at that. I think a really easy way to explain what a doula is like, we're the coach. If you understand American football, we are the coach. We are not the quarterback. As the doula, I'm preparing you. I'm offering you some perspective. I'm reminding you of the game plan of your goals. And I'm helping you adapt when things change, because things always change in birth. But when it's time to make like a decision or a play, that's you. You're the quarterback, okay? You are the one that's going to be making the decision. I think this is probably not clarified enough, but like the difference between advocacy and decision making, because I've had people call me and, oh, I want you to be my advocate. And I'm like, okay, well, what does that mean to you? Well, I want you to speak for me and I'm like, I think it's very important to distinguish that. So if I'm gonna be an advocate for you, I'm empowering you, or if you're a doula, you're empowering your clients to make informed decisions and communicate their preferences with confidence. So a doula might advocate by helping a client understand their options. So, oh, the pain is getting worse. Okay, here are some pain relief options. We can go in the shower, we can go in the tub at this point, maybe not. Maybe you can get a cold, wet rag. Maybe we can use a TENS machine. Or I may encourage them to ask questions. So I had a client once, the doctor was like, okay, stop pushing. What do you know about an episiotomy? And the client was like, I don't really know. I was reading on it, but I'm not 100%. And she looked at me and she was like, should I get it? And I was like, let's ask the doctor, what are the benefits and the risks and the alternatives to this episiotomy? Because she was having precipitous labor. Her baby, she was basically having like ejection reflex, and she started to tear in a not so great spot. She and the doctor took a pause, and literally like 5 minutes, they had a freaking conversation. And she decided on an episiotomy, and the doctor was like, it's going to be the tiniest cut. And it was just really great to see this conversation happen. But they're having that conversation. I'm not speaking on their behalf. I'm not yelling at the doctor like, you're a maniac for wanting to cut her. Like, none of that, right? Like, I'm still being respectful because I still very much respect OBs and the skills that they have, the knowledge, the experience, and how much they invested in that as like a human being to be like a freaking surgeon. So, the other thing that you might do as an advocate is reminding your provider of the client's preferences. So like when the placenta is delivered, maybe your client wants to keep it so they can bury it under a tree. I may like talk to the labor and delivery nurse and be like, oh, just a reminder, they want to keep their placenta. And the labor and delivery nurse is like, yeah, well, we need to take it to pathology. And I'm like, but that their preference is to have the placenta. And I know that you only need a small amount of the placenta to do anything with regards to pathology. So can you just cut the small piece that you need and leave the rest for the client? That's really important. Yeah. And just using some like frameworks to help the clients start to learn how to advocate for themselves. All right, decision making. Decision making is the responsibility and legal right of the birthing person, of the mom or their designated decision maker, so their husband or their spouse, in partnership with their healthcare provider. And none of that does it say doula involvement, okay? And some medical decisions would be including like accepting or declining an induction, choosing an epidural, choosing a cesarean birth, or agreeing or accepting, I should say agreeing to a cesarean birth, accepting continuous fetal monitoring, choosing newborn procedures like vitamin K shot or Hep B, or taking the baby away to do the newborn assessment versus keeping the baby in the room with the mother. Those kind of decisions are never made by the doula. Never. Okay? Again, as a doula, I am not trying to convince you to do anything. I will not try and convince you to have a water birth. I will just answer your questions like, oh, what's your personal perception on it? And I would be like, I think it's really beautiful. And the ones that I have been able to witness have just been really amazing and calm and went really quickly. And then I'll be like, here's some evidence-based research on water births, right? So I'm also not going to give you medical advice. So again, like, should I get the DTaP vaccination? I'm like, well, you should consult your provider, but also here is some evidence-based research on DTaP vaccinations during pregnancy. I'm not going to recommend one treatment over the other, and I will not consent to medical procedures on behalf of you as the client. So doulas and anyone watching this video, like, when you are interviewing a doula and you ask, will you advocate for me? You need to understand what you mean. What do you mean when you asking that question? Plain and simple. So I'll give you an example. If I'm advocating for someone, I'll be like, would you like more information about a C-section before deciding? And then a client will make the decision saying, I'm choosing to have this C-section. The other one is like, advocacy is, I'm like, let's review your birth preferences. A decision making might be, I would like to wait another hour if it's medically safe for me and my baby to do so. Yeah, I hope that this is like making sense. And ultimately, I want to wrap up this video, and that is that advocacy does not mean that I am speaking for you. It means that I'm helping you find your voice in this you're in a vulnerable state and you're surrounded by strangers. You're in a strange place if you're not having a home birth, right? decision making is not the role of the doula. It is the role of the client. Or again, their like decision making person, which is usually their husband, right? Or their partner. I want to make sure that you understand the doula's role is to make you feel informed, make you feel heard, and make you feel supported every step of the journey, from fertility to postpartum. I hope that this video kind of clarifies that. Because if you have a doula and they're like telling you your baby is breech and they are trying to flip your baby for you, like by doing something that is medical procedure, I think, you know, like that's probably a really shit example, but they're not supposed to give medical advice. They're not. A doula can tell you to do spinning babies because that's not medical. But a doula cannot perform an ECV to help turn your baby, if that makes sense. Yeah, that's a big one. Some people try to free birth with just a doula. If you're a doula and you have a client that is trying to free birth with just you, you need to understand the state laws in that state or even country where you're at. You also need to understand that insurance companies will not pay you for a free birth. So like Medicaid will not pay you for like a deliberate free birth. Your client has to have a Medicaid approved provider because you have to get a recommendation letter from the provider to bill Medicaid in I think most states now, okay? In some states you don't need it to bill, but they may audit you later just to make sure they're not paying someone who is like supporting free births. It just know the laws in your state and just like freaking obey the law. Like that's all I can tell you to protect yourself. So sometimes I do see inquiries for people who are like, I'm doing a free birth, and I love that for them. But what I can tell you is perhaps you send them some evidence-based research and legitimate resources like free birth classes that they can take. But don't be in that house doing that free birth as a doula because you're not a medical professional. And it is 99.9% illegal for that shit to be happening in most states in the United States. That's just like it, the truth. So, thank you so much. I'm gonna have some more vlogs coming. I'm recovering from vacation, from holiday, and from traveling a lot. Our summer's still happening. We still have some other stuff to do before the school year starts, but I just want to thank you again for tuning in. Thank you for listening to me. Thank you for giving me your time. Please, 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 please subscribe and like and share this content maybe with some other doulas or people who are aspiring to be a doula or families who are looking for a doula. I also provide virtual support. So if you want a virtual doula, maybe even on call, so you don't actually want me to show up to your birth, but you still have questions during labor, I will support you like that as well. Thanks again for tuning in, and I hope you have a wonderful summer week? What day is it? I don't know.